What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we are covering the most craziest things I've seen in the emergency room. We're going with the top one of 2025. I know we're barely into April, but I've seen the most wildest thing I've ever seen in my 4 years of doing x-rays. So to give you context, I work at a trauma 3 ER. I am a fully licensed Xray tech. So the most wildest thing, due to HIPAA, you just gotta keep it, no names, no none. So we had an 18-wheeler crash in the middle of the night. 18-wheeler versus a tree, and I think another 18-wheeler hit it. And essentially, the person came in with their foot cut off. Which you see that a lot, but you never see the actual other piece of the foot. So what we witnessed was they brought in a separate little bag, in a red little bag, a foot. Well, it's like a foot with a fibula stuck on it. To this point, I've always seen people come in like with stuff like cut off, but we never actually seen the other part, the remain. So I was a little bit excited, and I didn't know how my body was going to react, because usually I do pretty good with like blood and all this stuff, because I mean, if you work in this profession of x-ray, you're going to see crazy stuff. But my first reaction was like, dang, that's wild. My tummy got warm inside. Never had that feeling before. And it was wild because they propped it up, they put it, and like the fibula was just sticking up. And for like a second, you would look at it and it looked like a Halloween prop, which was wild. Like, you would never, like, it just looked like pale Halloween prop. Like, it didn't look real until like you looked at it, and then you looked at the patient, and then you look back, and then like, it's just like my brain couldn't, like, it was just a surreal moment. It was just something that I feel like once you go through that, you just kind of like leveled up in the x-ray world, or in your profession. Like, you have that underneath. And I mean, as far as what we actually did for the patient, we just x-rayed his we essentially did a tibia, which it wasn't until we x-rayed him that we noticed that there was like a giant little gap. When we were doing the lateral, you could see like literally where the fibula goes in, like you just see like a little tiny hollow spot, which was wild. I've never seen that before. Like, and as far as like on the x-rays, you just see the tibia and like the fibula is missing. And usually with most patients that have like diabetes or anything like that, you'll see like both of them. Like maybe their foot gets cut off or something, but you'll see both. But that one, it just looked kind of weird because it was just a fibula and like there was nothing supporting it. So like when we were kind of moving it, like it was kind of like squishy, and the other, it was something different. It was something that it was exciting. It was wild because like when you get into our profession, yes, you're here to help people. Yes, like, but like you kind of become almost like very few things get you excited once you do this for so long. And like you feel bad for the patient, but like you should have seen the emergency room when they're like, we have this and that, full hands on deck. All the nurses, we only have like 2 doctors overnight. They were all fully suited up like the Monster Inc. And like we had people that usually don't come down to the emergency room. We had like upper level nurses like come down. Like we had the whole squad waiting for this man. Surgery, everything. Everyone was there. And everyone was like, oh, man. And most people don't really get to be hands-on that close unless like you're actually the nurse or the doctor who dealing in the trauma room, and like, of course us x-ray and CAT scan. So like we're like right there. Like it is wild to see stuff like that. By far the most craziest thing I've ever seen that come in my emergency room. I just wanted to like document it and like let y'all know. Once again, the protocol was still the same. We did a bunch of cross table, and surprisingly the patient wasn't in pain, but I guess between the adrenaline and the amount of drugs they gave him, homeboy was just chilling. He was just like looking at his leg, and then looked at the thing, and like the patient's like, am I able to like keep my leg? And the doctor was like, we'll talk later, But it was just something surreal that I would never seen like that before. But I just want to document it, let y'all know, and just for me to have in my archive and the top things, craziest things I've seen. And of course, with something like that, of course, like after that, the doctor will like give a little spiel of other crazy things they've seen like that. But for me, as far as my profession, that is the most wildest thing I've seen. But yeah, it's been your boy Miguel. See you on the next one.